And now I will show you the structures or deep structures on the back of the thigh. Mainly in the back of the thigh, you will get the hamstring muscles. There are 4 hamstring muscles, namely the semimembranosus, semitendinosus, long head of biceps femoris, and the ischial fibers of adductor magnus. They all originated from the ischial diversity of the hip bone and inserted beyond the knee joint. I mean either in the tibia or in the fibula. But short head of biceps femoris is not a part of the hamstring because it arises from the linea aspera of the femur, not from the ischial diversity of the hip bone. And also it is not supplied by the nerve which is supplying the hamstring groove. Hamstring muscles are supplied by the tibial component of sciatic nerve, but the short head of biceps femoris, it is supplied by the common peroneal component of sciatic nerve. So for these two reasons, one is origin from the linea aspera, not from the ischial diversity, and another regarding its nerve supply, which is from the common peroneal nerve, not from the tibial nerve. This short head of biceps femoris is not considered as a part of the hamstring. Others 4 muscles are hamstring muscle. Now I will show you this hamstring muscle group. Now see the back of the thigh. This is lateral side, this is the foot, so this is the little toe, so lateral side, this is medial side. So this is lateral, this is medial. If you see on the lateral side, this muscle is the biceps femoris, and can you see this is the one head, this is another head, this is long head coming from the ischial tuberosity here, this is ischial tuberosity, and short head from the linea aspera of the femur here. So these two heads or two belly, they join together and forming a common tendon and inserted into the fibula, upper end of fibula. And medially, if you see, there are 2 muscles. This is another, this is one, and below it another one. But this muscle also originating from the ischial tuberosity, but having long tendon. But in compared to that, this muscle, the tendon is small. Rather, it is muscular and membranous. So this muscle is called semitendinosus, inserted on the medial side of the upper part of the shaft of the tibia, along with the sartorius and gracilis. So 3 muscles attached on the upper part of the medial surface of the shaft of the tibia. If you are asked what are these muscles, the answer will be semitendinosus, one is sartorius and one is gracilis. The 3 muscles coming from 3 different parts of the hip bone, the semitendinosus from the ischium, gracilis from the pubis, and sartorius from the ilium, and their nerve supply also different. The semitendinosus from the tibial component of sciatic nerve, then sartorius from the femoral nerve, and gracilis from the obturator nerve. Then deep to the semitendinosus is the semimembranosus. This muscle also having the same source of origin from the ischial tuberosity here and inserting on the tibia, posterior surface of the upper end of the tibia. And another muscle deep to it is the adductor magnus or ischial fiber of adductor magnus here, and adductor part will be on the medial side. Here is the adductor part on the medial side and extensor part or ischial part on the lateral side. So the biceps, then semitendinosus, semimembranosus, and adductor magnus, they are the muscles on the back of the thigh, and this nerve is the sciatic nerve. If you trace it upwards, sciatic nerve, it comes out below the piriformis muscle. This is piriformis. So this is greater sciatic foramen, this one divided by the piriformis into upper compartment and lower compartment. So through the lower compartment of greater sciatic foramen below the piriformis, this nerve is the sciatic nerve, and in the middle of the thigh or maybe at the upper level, it divides into 2 branches. The one branch is passing straightway back to the posterior compartment of the leg, which is called tibial nerve, and this component is called the common peroneal nerve. This common peroneal nerve on the lateral side of the neck of the fibula, it divides into deep peroneal or anterior tibial nerve and superficial peroneal nerve and supplying the lateral compartment muscles. But in the back of the thigh, you will get the sciatic nerve and its 2 divisions, and deep to it, you will get the artery. What artery you will get? Here you will get popliteal artery. This artery, before fifth osteoaponeuric opening of the aorta magnus, it was femoral artery in the anterior side or the anterior aspect. But in the posterior compartment and in the popliteal fossa, it is known as a popliteal artery. And also you will get the popliteal vein. So if you see the three important artery and vein in the posterior compartment, one is the sciatic nerve, then the popliteal vein and the popliteal artery. Here also in the popliteal fossa you will get the popliteal vein and popliteal artery, but superficially you will get popliteal vein, deep to it you will get the popliteal artery. I am coming to that part afterwards. I have shown you all the muscles of the back of the thigh.